Welcome back to Chamber Exchange, a TV show, our final segment. I want to thank our sponsors that make the show happen. That's Bank Hometown and St. Vincent Hospital. And with that, in our third segment, we got Ray Marsh, who's the Senior Outreach Manager for Recovery Centers of America, and particularly their Westminster location. Ray, welcome.
Yeah, thanks for having me, Tim.
Yeah, well, I want to just say first, thank you. You're an active and involved member of the Chamber. Attend a lot of our events and programs, and we always appreciate that.
Absolutely.
But, well, the work that you do with Recovery Centers of America, I think for our viewing audience, the issues of recovery are important. Every family business operation probably has a story on how they've been impacted. And what is your kind of role as outreach manager involved in terms of letting people know about the resources, and then kind of when people come forward, kind of facilitating them getting the services that they need?
Yeah, absolutely. So our mission is to save 1 million lives that are impacted with substance use and mental health disorders, one person at a time. I serve as a treatment advocate in the community, so I work with local hospitals, recovery coach organizations, primary care, psychiatrists, therapists, anybody that would need to get a patient potentially into treatment, into a higher level of care, what we offer. The other thing would be is working also just with families in the community that are trying to get their loved ones the help they need, help bridge those gaps, and break down any barriers to getting their loved one to consent to coming in for treatment.
Yeah, and I want to spend most of this interview talking about specifically the services that Recovery Centers of America provides. But again, you turn on the TV, you listen to the radio, you pick up the newspaper or read it online. The issue of addiction and mental health issues, pervade society and all different levels, all different age groups. And one of the things that consistently comes up in a lot of those stories and conversations is how difficult and challenging it is to find access. The shortage of beds, the shortage of programs. Before we get into recovery centers, what's just kind of your analysis of that as someone who's involved in the field?
Just with barriers you're talking about?
Yeah, just the shortage and the need.
Yeah, so I think our local hospitals are always looking for beds. They have people in the ED that now qualify for medical detox, and we have RCA's fast track program, so that was designed to work with the local emergency rooms, and if the patient can step down safely to medical detox like ourselves, then we can take them right into our facility. Another barrier is 24/7 access with transportation, and we do provide that access, transportation for anybody, and truly 24/7, 365 admissions. A lot of places close down early. We truly are 24/7, 365 with transport.
Yeah. Now, is that as a result of kind of the size of the facility, or just kind of the scale that Recovery Centers of America has, and the facility particularly in Westminster?
We do have quite a bit of beds at the facility. We just know that those are typically two huge barriers. I think another barrier that we sometimes see is individualized programming for our first responder population as well. So we have a specialized unit at the Westminster site that prioritizes first responders and active military as well, to get individualized care for themselves and to recover with dignity and respect with their peers.
Yeah. And I believe that there's some data out there to kind of indicate that the people in certain fields, because of some of the stresses and traumas that they have, may have a higher predisposition to maybe having alcohol issues, other things, just as in response to kind of some of the trauma and things that they experience. And is that kind of what drives the first responders and some of that particular programming? Yeah,
absolutely. There's that secondary trauma that they have from the roles that they're in, and going to a regular facility where they're recovering with general population, they're not as able to really open up and really start the recovery process. They can be really open and honest in our facility on that specialized unit, because the programming is specifically designed to handle some of the unique mental health needs along with the substance use needs.
Yeah, peer-to-peer. Mm-hmm. So beyond with the kind of first responder program, I assume there's some other programs that exist depending on kind of the issues and needs and where somebody is in the process?
Yeah, so RCA has their Pathways program. So we have DBT specific groups. DBT is evidence-based modality that helps teach our patients usable skills so that they can handle when they're motion regulation or distress tolerance, teaching them those skills to be able to handle those things once they get back into the community. So one of the pathways is called Balance, and it's specifically designed for co-occurring mental health and substance use disorder. The second pathway would be foundations. So those are for people that it's their first time in treatment. There's a lot of fear behind coming into treatment for the first time. So, breaking out those people specifically so that they can talk about their unique needs. And then our other pathway is called Fresh Start. So for people that have been in treatment before, really looking for what skills might be helpful to layer on in order for them to, have success in recovery.
In that latter part you just mentioned, the Fresh Starts program. I mean, it's not uncommon for someone to relapse or have an issue, and sometimes ultimately it might take a couple of times for someone to really stay clean or sober and kind of get at that stable path. So it sounds like that would be a program that people would utilize.
Yeah, absolutely. And we do a screening process to make sure which one would be most beneficial for them. And that's just that individualized care that RCA does provide. We want to make sure that, that is part of the treatment process sometimes is, people need to come into treatment again. Myself as an outreach manager, people, I build that rapport with people so that they can call and feel comfortable calling again. Hey, Ray, I need to come back into treatment, and we will welcome them back, and we will start the process again with them.
Yeah, and the other program you had mentioned prior to, I think, Fresh Starts, dual diagnosis or somebody with...
Yeah, it's called Balance, and because a really high percentage of our admissions typically struggle with both. So really being able to handle not only the substance use needs, but the co-occurring mental health that sometimes drives some of those symptoms with the substance use.
Right, or sometimes the substance abuse issues mask. So it's important to really drill down and understand.
Yeah, that, and also having access to our psychiatrists or psych MPs at the facility for med management. They're able to assist and help those people. And a lot of times when people are looking for treatment for both, those are the services. They want to have a therapist. They want to have a psychiatrist that they have access to. So they do have that at our facilities.
Right. Now we know there's a cost to all of these things. People need to get paid for their work. So I assume people with health insurance, private pay. How do you kind of work with people depending on where they're at financially?
Yeah, so we do offer self-pay options with payment plans. So that is an option if somebody is uninsured. We also take most major insurances as well, and we're able to help with if somebody has a high deductible or a high financial responsibility with the type of plan they have. We will work with them to try to come up with a payment plan. To help them not have that cost not be a barrier to their treatment coming in. Right.
And so, Ray, as we said, this is a challenging issue, and people are in need of services. How do they get a hold of you? It sounds like you can do that assessment, kind of help introduce them to the right program initially. So how can they get in touch with you?
Yeah, the easiest way is our 800 number. So it's 1-800-RECOVERY. That's 1-800-732-6837, or they can go online at recoverycentersofamerica.com.
Great. Ray Marsh, Senior Outreach Manager, Recovery Centers of America, the Westminster location. Thanks for being with us.